Today, we will going to see iron deficiency anemia. Okay, various types of anemias are there. In that, one of the type that is iron deficiency anemia. The name itself indicates that there is a deficiency of iron. Okay, it is caused by lack of iron. Means only it is having deficiency of iron. Iron deficiency due to what? There are also various causes are there. Okay. Insufficient dietary intake and absorption of iron or iron loss from bleeding. 3 causes. Okay. Again, causes are there. First of all, dietary intake. If our diet is having less iron, then also there is a deficiency of iron. If diet is proper, but there is a problem in the absorption, then also there is a deficiency of iron. And directly, that is the loss of bleeding. Okay. The most common cause of the iron anemia deficiency in children is presence of parasitic worms. Presence of parasitic worms in the intestine. If the parasitic worms are there, we are seeing most of the children, they are having the worms in their intestine. If that is there, then also there is a iron deficiency anemia. In addition, malaria, hookworm, and vitamin A deficiency contribute to the anemia during pregnancy. During pregnancy, in addition, malaria, if malaria is there, you know, there is a deficiency of iron. Hookworms is there, most of all in the children. Okay, vitamin A deficiency also contribute to anemia during pregnancy. In a woman over 50 years old, means a woman 50 years of old, the most common cause of the iron deficiency is chronic gastrointestinal bleeding from non-plastic, from non-parasitic worms. Okay, from non-parasitic worms. In the 50 years old woman, there is iron deficiency due to chronic gastrointestinal bleeding. Maybe chances are there to form a iron deficiency anemia. Now, we will see here a normal hematocrit range. Actually, hematocrit range, see carefully, listen carefully. Hematocrit ranges, that is the 34.9 to 44.5% for the adult women and 38.8 to 50% for the adult men. And the normal hemoglobin range is 12 to 15.5 grams per DL, that is the deciliter. For an adult woman, normally we say that 12 to 15 or 16 grams per DL, okay? And in the adult man and in the male, it is of about 14 to 18, usually we said, that is exactly 13.5 to 13.5 to 17.5 grams per deciliter, grams per DL. Hemoglobin ranges from unit you have to keep in your mind, that is the grams per DL. Actually, we say that 13.5 or mostly 14 to 18 grams per DL. Okay, in male, And in female, actually 12 to 16 grams per dl. In iron deficiency anemia, the hemoglobin levels are low. Hematocrit also low and the hemoglobin level is also low. Okay. Also, there is RBCs are smaller in size. RBCs are usually smaller in size than the normal. Okay. These are the causes. Now, signs and symptoms. Fatigue. Actually, we see normally same signs and symptoms are there. Little bit difference is there because of low levels of the hemoglobin, low levels of the oxygen, low levels of the RBC means there is a deficiency of oxygen carrying capacity. So in the body, there is a less oxygen. So obviously there is a fatigue, lightheadedness, weakness, anxiety, irritability, mouth ulcer, fainting, that is giddiness, breathlessness. All these are the signs and symptoms. How to diagnose this one? Physical examination, okay? And by blood testing, that also complete blood count, that is the CBC count, that is the CBC count. In that CBC count, what we will check here? RBCs, WBCs, platelets, hemoglobin, hematocrit, everything we will check. And by seeing, by testing that one CBC, by checking the CBC, we can understand, we can give, we can provide all the information of our blood. This is all about the diagnosis. Main diagnosis, that is the physical examination by the doctor, and that is the next one, that is the CBC. In that CBC, we can measure here, we can understand the values of the RBCs, WBCs, platelets, hemoglobin, hematocrit, everything. Okay. Now treatment. Having iron deficiency, so supply that one, give the supplements or provide that type of the diet, isn't it? Or externally the iron supplements, iron tablets, iron tonic, isn't it? Or the diet which is rich in the iron, okay? If the underlying cause of iron deficiency is loss of blood other than from the menstruation, the source of the bleeding must be located and stopped. Other than the menstruation is there, if there is more loss of blood is there, other than menstruation in the women's side. But if it is other than that one, then we have to stop that type of the bleeding. This may involve sometimes the surgery. This may involve sometimes, if not properly we can stop, then we have to do the surgery. Okay. Next one, iron deficiency consequences. What the consequences takes place? Impair the physical growth, compromise the cognitive development, that is the memory. Okay, cognitive development, it is the memory development. Because of low levels of the oxygen, the brain will not work properly, isn't it? Impaired learning capacity, the learning capacity, first stage of the memory, that is learning. Okay, so the cognitive, that is the memory, retention, isn't it? But first stage, that is the learning capacity, also hampered, reduces the muscle function. That is the weakness is there. Decrease the physical activity and lower work. Okay. Increase the risk of infection diseases. There are more chances to cause the infectious diseases. This is all about the iron deficiency anemia. Understood this one? Iron deficiency anemia. Okay. We will stop here.